I'm Dr. Brian Goldman, and this is Anonymous Health Questions. Is aspartame making me sick, or can I drink Diet Coke every day? The short answer is yes, you can drink Diet Coke every day within limits. There's an old story of aspartame putting you at risk of cancer, particularly brain cancer. The safe limit is 40 milligrams per kilogram per day. So a 75 kilogram person can drink 9 to 14 cans of soda every day. Just keep in mind that if you're drinking big gulps or other substances, you need to be aware that you might be exceeding. The Food and Drug Administration says 50 milligrams per kilogram per day, but it's somewhere within that range. And if you do that, you'll stay safe. Do you know anything about MDMA or mushroom therapy for mental health? Is it a legitimate breakthrough or just hype? We're not sure. I think it's a legitimate breakthrough. Psilocybin is being researched as a potential treatment for PTSD, for depression that is resistant to other forms of treatment, for anxiety, obsessive compulsive disorder, and other mental health conditions. It is part of legitimate clinical research trials. It's not magic mushroom at the dose you would get if you bought magic mushrooms. Remember, it is an illicit substance. It's a highly controlled substance. And when it's used as part of a research project, it's microdosed, and it is used as part of something called psychedelic guided therapy. So if you're interested in it, I would seek out on the internet the researchers who are actually doing clinical studies on psilocybin and work with them. The whole idea behind psychedelic guided therapy is that you're not alone experimenting on your own. You're with a therapist who's decided that it's right for you, that it's potentially right for you, and is with you as you go through the experience. Sometimes it might take 1 or 2 treatments for you to have a breakthrough. The way it works is that it breaks through some of those ruminating thoughts that you have, and it also increases emotional flexibility, and it could be potentially very helpful for people with treatment-resistant depression, PTSD, and other mental health disorders. Now, MDMA, same deal, except there's less research that has gone on thus far regarding MDMA than there is for psilocybin. Again, it might be helpful for patients with treatment-resistant depression, PTSD, and other mental health conditions. Like psilocybin, it is an illicit substance, and I would wait for more research before I got interested in trying MDMA for mental health conditions. I keep seeing urine therapy on TikTok. Is drinking your own pee actually beneficial, or are these people losing it? I can't tell if you're losing it if you take it, but I can say that urine therapy, which is also known as urotherapy, Amaroli, or Shivambu, is an alternative medicine practice. It might involve drinking the urine. It might involve rubbing it on your skin. There is absolutely no scientific basis for urine therapy of any kind, and I can't possibly recommend it, and I don't think it would be particularly healthy for you to do. Is the carnivore diet of eating only organ meats, liver, heart, etc., actually healthy long term? Well, like all questions in medicine, that depends. So let's start with what's an organ meat diet. It's a diet, like the name says, it consists of eating only organ meats. So bone, solid, which is an organ, a lot of people don't, skin would be another organ, lungs, heart, kidneys, liver, spleen, pancreas, thyroid gland, thymus gland. Thymus gland is something called sweetbreads. Brain is another example of an organ that you can eat. The main benefit of organ meat is that it is, from a nutritional standpoint, among the most nutritionally dense foods that you could possibly eat, but it's also high in iron, in B vitamins. It's high in alpha lipoic acid, or ALA. It's high in 3 minerals, magnesium, selenium, and zinc. So those are all good things. The downside is that it's high in saturated fats, which means if you're at risk of cardiovascular disease, it can worsen that. It is also a contributor to fatty liver and type 2 diabetes. So the bottom line is that when it comes to an organ meat diet, sample it, make it a staple, a daily staple of your diet. I think the downside risk is greater than any potential benefit. Are protein shakes actually good for weight loss, or are they just empty calories? No, protein shakes are not empty calories because they contain protein. Will they help you lose weight? Yes. If you just have the protein shake, don't eat a lot of other calories during the day, but the reason why you're going to lose weight is not because of the protein shake, it's because you're eating less. There's nothing magic about protein shakes. If you want to add them to a balanced diet, can't hurt. On the internet, on social media, people are obsessed with protein, that you're supposed to have a high protein diet. If you've got bad kidneys, it's just going to put your kidneys at risk of further damage. Is there such a thing as eating too much protein? Can it hurt you? Short answer is yes, it can. I don't know why there's this obsession with protein on the internet, but there is, so I think we have to deal with it. You need protein. Yes, you need protein to rebuild your bones, your muscles. There are protein structures in every part of the body. The problem is that a high protein diet is often a fatty diet, increases saturated fats, puts you at risk of cardiovascular disease. So, like your mother and your grandmother said, everything in moderation. So stay within the limits, eat a balanced diet that includes protein. Is red light therapy worth the money for skin or muscle recovery, or is it just snake oil? No, it's not just snake oil. Red light therapy is a treatment that is being offered by a growing number of dermatologists to help improve the turgor of the skin, to help reduce wrinkles, to help reduce scars, and help the skin heal and look more youthful and more supple. Many, many types of potential red light therapy: LED light, non-thermal LED light, soft laser, cold laser, photomodulation, phototherapy. So it's not snake oil. Some of the drawbacks include the cost, skin irritation. So you want whoever is providing the therapy to know what they're doing and know what the potential risks are, but it's not snake oil. Does creatine actually do anything for you if you aren't a bodybuilder? It does. There's actually a lot of evidence for creatine. Creatine helps to rebuild muscle. It's particularly helpful in improving the intensity of your workout on a temporary basis. So if you want to get those fast twitch muscles to recover faster and work harder so that you can run faster, lift a little bit more, have a more intense workout, then creatine works. The usual dose of creatine that's recommended is 5 grams per day. Doesn't have a lot of side effects, although if you start getting north of 10 grams a day, and some people will push it that high, you might start getting nausea, intestinal cramps, and diarrhea. If you're a long distance runner, if you're talking about cardio, creatine does nothing for cardio. There is one potential area of research where I'm keeping my eye on. I've got lots of family members with dementia. I don't want to get dementia myself. I note that there is a controlled clinical experiment out there of people in the early stages of Alzheimer's dementia who took 20 grams per day of creatine over an 8-week period, which is a big dose. You probably have to take it in divided doses if you want to be able to have the benefits and not have the side effects. And what those researchers found is that the subjects engaged in that study had lesser progression and some recovery of their memory function. I think we need to see more studies, but certainly when it comes to the potential for creatine, I think there may be a potential for it to be more beneficial than we at first thought. For those doing OMAD, 1 meal a day, is this actually sustainable for years or just a crash diet? Well, it depends on what you mean by OMAD. OMAD is 1 meal a day. It's a weight loss plan. Another way of looking at it is intermittent fasting. It involves the 23-to-1. So you have 24 hours in a day. You spend 1 hour eating, the other 23 hours fasting. I guess you can drink water at that time so you don't get dehydrated. Most of the OMAD diets that I've seen have talked about starving all day and then having a 1 hour dinner. So having your one meal at dinner time. I think that's not the smart way to go. That's going to predispose you to diabetes, and that's because skipping breakfast is not good for your glucose control and can help contribute to insulin resistance and type 2 diabetes. So if you're going to do OMAD, intermittent fasting, then I would have that meal as breakfast. That gets you going and ready. You have energy to face the day. Is this sustainable? What are the drawbacks? You're going to get fatigued. You're going to get tired. You might faint if you don't get enough fluids. I think it's the kind of thing that if you're going to do it, if you're going to try it, I would do it under a doctor's supervision, the supervision of a healthcare provider. The more intriguing area of research regarding intermittent fasting is the possibility that it might increase longevity. And we know that from lab animals, studies of mice, rats, that are subjected to intermittent fasting. They tend to live longer than rats that are allowed to eat ad lib. But I'd like to see more research, and I think we need to see research in human beings to see if we can do this, and not only do it, but find a way to do it so that it's safe and has no deleterious side effects. Are multi-day water fasts good for your health or just starving yourself? Oh my goodness. Multi-day water fast. A multi-day water fast typically involves 24 to 72 hours, but some people on the internet are bragging that they're fasting for up to 7+ days, consuming only water to promote weight loss. And the idea behind this, there is a bodily mechanism called cellular autophagy, whereby starvation induces the body to consume itself. So the assumption here is that the body is going to be induced to degrade or digest previously damaged components like misfolded proteins and pathogens, and it's going to use liposomes to do that. It's a nice theory. I'd want it to be studied in human beings, and I'm not aware of any studies that are looking at it other than the uncontrolled experiments of people who are on hunger strikes or who are subjected to torture, and I certainly don't recommend that. The obvious drawbacks to a multi-day water fast diet are dehydration and acute nutritional deficiency, fainting, fatigue, cognitive deficits that are associated with not eating, with not having nutrients for several days, vitamin D deficiency, and other vitamin deficiencies. The general recommendation is that if you're going to go on a water diet, like a multi-day water fast, it should be no more than 72 hours. And if you're going to do it for more than 72 hours, you really have to have a doctor's blessing and potential access to treatment like intravenous therapy in case you suffer some of the deleterious side effects. I certainly would not recommend it for longer than 24 to 48 hours personally. Do these liver detox teas and pills actually work, or does the liver do that on its own? First of all, there's no organ in the body that's better at detoxing than your liver. So my advice is don't opt for a liver detox teas or pills. Don't damage your liver with too much alcohol or overeating, which leads to fatty liver disease. Liver detox teas and pills contain things like turmeric, dandelion root, artichoke, and milk thistle. They allegedly reduce inflammation, and we know that inflammation in the body is not good for you. These supplements are loosely regulated by health regulators like Health Canada and the Food and Drug Administration. They lack sufficient clinical trials on safety and efficacy. I'd be more concerned about dangers than I would be about potential benefits. My advice to you is don't do it. Why is everybody excited about apple cider vinegar? Well, not me. Apple cider vinegar is an amber-colored vinegar. It's made from fermented apple juice. It's touted, well, of course, it's used in cooking. It's touted as a remedy for weight loss, blood sugar control. It may help with insulin sensitivity, but really the evidence for apple cider vinegar is very, very limited, and I certainly don't think you need a shot a day of it. Do healthy people actually need a daily multivitamin, or is it just expensive pee? It's funny, I heard that expensive pee joke in medical school by my nutrition prof. Taking a daily multivitamin will not harm you. Do you need it? No. If you have a balanced diet, you'll get all the vitamins and minerals that you need. But there are some specific ages and states of health where having a vitamin can be helpful. Certainly, if you're suffering from iron deficiency, you can have iron deficiency without having anemia, then you need to be on iron supplements. Anybody who lives north of the 42nd parallel, which means just about everybody in Canada, will lack vitamin D because they lack sunlight. They need to eat foods that are fortified with vitamin D or take vitamin D. And I know there's a lot of information out there of the potential benefits of vitamin D. It was regarded as a wonder vitamin a few years back. That reputation has kind of been dimmed lately in light of more recent research, but there is potential for megadose vitamin D being helpful for some people. Women who are near menopause or post-menopause who are at risk of osteoporosis need calcium, so they should be drinking milk, and if they don't drink milk or if they're lactose intolerant, then they should be taking calcium and vitamin D. Vegans need to be taking vitamin B12. Omega-3 fatty acids, which come from fish, support heart and brain health. So if you have cardiovascular disease and you're not getting adequate omega-3 fatty acids coming from fleshy fish, then you should be having some kind of a fish oil product. Otherwise, bottom line, balanced diet should give you most of the vitamins and minerals and other nutrients that you need. Women who are pregnant or trying to get pregnant should have folic acid because folic acid prevents neural tube defects in their unborn children. Biotin, vitamin B7. Okay. Does biotin actually help with hair loss, or am I just wasting money? Well, you're not wasting money if you have a bona fide vitamin B7 deficiency. So for those people, biotin supplements may help improve hair thinning and loss, but they're the ones, you have to have a proven deficiency for it to help with hair loss. It's a rare condition, vitamin B7 deficiency. There's very limited evidence that it helps any other people with growth of hair loss. And there are doses out there of 5,000 micrograms per day. They're often being recommended. Really, you only need 30 micrograms per day. So for the other, 4,900 4,970 micrograms that you're taking each day, you're probably wasting your money. There are proven effective therapies for hair loss that are regulated. So topical minoxidil or Rogaine for men and women, oral finasteride, which is Propecia, or dutasteride. Those are recommended for men. Those can be prescribed to men. And then there's things like low-level laser therapy, platelet-rich injections. The problem with most of these treatments is that you have to be diligent about using them. So you have to use them for a long period of time to see results, and you must continue to use them because if you stop using them, they stop working. Why is everybody suddenly saying seed oils are toxic? Is there real science behind that? No, well, first of all, I don't know why everybody's suddenly talking about it, but there isn't a lot of evidence to say that they're particularly toxic. Seed oils, canola oil, soybean, sunflower oil are not toxic in and of themselves. They're part of a healthy diet. They're rich in unsaturated fats. They can help lower bad cholesterol. I guess the problem with seed oils is that they've been packaged in something called ultra-processed foods. And ultra-processed foods, there's growing evidence that ultra-processed foods can be very harmful, but it's not because of the seed oil. They're part of a balanced diet. Can doing too much cardio actually be bad for your body or your heart? The short answer is yes, it can. It can lead to overuse injuries like tendon and muscle injuries, ligament injuries, persistent stiffness, muscle atrophy, stress fractures. It can lead to something called the overtraining syndrome, which is more of a behavior thing. It consists of chronic fatigue, trouble sleeping, moodiness, high volume, long duration cardio, like preparing for triathlons and other forms of extreme races can cause the muscles to break down. That can lead to rhabdomyolysis, which can lead to kidney failure. Excessive long-term high-intensity endurance training can also have cause heart rhythm disturbances, but those are rare, fortunately. It can also weaken your immune system. Quick signs of overdoing it. You're overdoing it if you have persistent muscle soreness, persistent injuries, stress fractures, constant exhaustion, low mood, low energy, lack of motivation. If you find that your performance times are actually going down instead of going up, that you're not hitting your previous times or your previous weights. The bottom line here is that daily moderate exercise, like 30 to 60 minutes per day, is essential for your health. But if you're exceeding 4 or 5 hours per day, you're probably doing more harm than good, or at least you're risking more harm than good. Is sugar really the root cause of basically every chronic disease, or is that an exaggeration? It's partly an exaggeration. We have in our society, in Western society, dramatically rising rates of obesity, early onset heart disease, cancer in young people, of course, rising rates of dementia, and that excess consumption of sugar is one of the major drivers of all of those diseases. And we know that Western society, Western diets full of ultra-processed foods, which are very high in fructose derivatives, which of course is a form of sugar. Eating those kinds of foods leads to chronic inflammation. Inflammation is the driver of many diseases such as cancer, to some extent heart disease, and even dementia. We also know that excess consumption of sugars can lead to obesity, which itself leads to inflammation and contributes to some of those diseases that I've talked about. And it also leads to insulin resistance, which leads to hypertriglyceridemia, increased abdominal fat, type 2 diabetes, and all the diseases that come from type 2 diabetes. The thing about ultra-processed foods is that they contain mainly complex fats and complex fructose and other sugars that do not occur in nature. They are highly dense nutritionally, which means that you gain more weight per gram that you eat of these substances, and they're highly addictive. They've actually been designed to be addictive. The sugar content makes them addictive. They are everywhere. Some of the worst offenders are sugary breakfast cereals, cookies, packaged cookies, potato chips, tortilla chips, cheese spread, pizza crust. If you want to avoid them, read food labels. Avoid or at least limit products that contain high fructose corn syrup or hydrogenated fat. The longer the name, the more it's artificial and doesn't occur in nature, and the more you shouldn't eat it. Try to eat more foods. When you go to a supermarket, try to spend more time on the perimeter of the supermarket where the freezers are, and avoid the aisles in the middle, because the aisles in the middle are full of ultra-processed foods. And those are foods that if they're not in the freezer, there's a good chance that they've been designed to have a long shelf life, which means they're going to contain a lot of chemicals. Do I eat chips? Do I grab a handful of chips every once in a while? Damn right, of course I do. I need a fix like everybody else, but it should be part of a balanced diet, which means eating much more whole grain foods, much more natural fruits and vegetables that have not been processed as much as you can. Look for foods in the supermarket like fruits, vegetables, whole grains, such as brown rice and wild rice, quinoa, plant proteins like soybean, And if you must have, I mean, there are some ultra-processed foods that are relatively healthy, and those would be whole grain cereals, whole grain breads that are enriched with nutrients, pita chips, and hummus are fairly healthy, even though they are ultra-processed. So not all ultra-processed foods are bad, but read the label. Should we trust AI like ChatGPT for health advice, or is it too risky? Well, it really depends on what you're using ChatGPT or other chatbots for. They're really good at translating medical reports into plain language. They can help turn complex language into age-appropriate language, so it's easier to communicate with young people. They provide useful summaries of information on diseases. They can also plan meals for people who need specialized diets like diabetic diets or Mediterranean diets. Do not ask a chatbot to diagnose your chest pain, and that's because chatbots are sycophantic. They are designed to agree with you, which means they're going to drive you down a path of inquiry that's probably going to be misleading, whereas your healthcare provider may ask you a question that appears to come out of left field because they know something that you don't know. It's not random. It's because you've said something that's triggered what they've said to examine another potential disease that you might have. Another reason why you should not engage chatbots for direct medical information about your own health is because you may be providing information, you may be sending information out there that tells people what diseases you have. Like, for instance, you're never going to ask a chatbot, my PSA was so-and-so, what should I do about it? Because you're telling the world you have an elevated PSA, which means if an insurer ever gets wind of that, they might cancel your insurance. Instead, ask, what are the reputable scientific-based websites to answer the question of what to do about an elevated PSA? That is a more neutral form of the question, and it doesn't telegraph to the world that you have a particular disease. So don't ask ChatGPT to diagnose your chest pain. There's another specialized area. Do not ask for mental health advice or engage in counseling with a chatbot. In fact, that's becoming increasingly popular. There's a study that showed that 13% of young people ages 12 to 21 have even more, 22% of people ages 18 to 21 have asked a chatbot for counseling advice for mental health issues. We know that there's a high prevalence of mental health problems in young people these days for a whole bunch of reasons, partly because of social media, because of access to smartphones, post-pandemic, and a whole bunch of other factors. Why shouldn't you ask a chatbot for counseling advice? Because the algorithm is designed to agree with you. It's sycophantic. That's what they call it. If you, for instance, have a psychosis, an underlying psychosis, where you have a formal thought disorder with delusions either of persecution or delusions of grandeur, and you start talking to a chatbot about having invented the universal theory for quantum mechanics or quantum computing, and you ask that chatbot, am I crazy for thinking I'm onto something? That chatbot is going to say, no, you're not crazy at all. You're definitely onto something. You should continue on this important area of research because what you're doing is very, very important. And there actually are reports that if you asked the chatbot, I think I'm being followed, I think the CIA is trying to follow me, am I crazy or could I be right? Chatbots are not designed to say, no, that is a delusion. You should seek immediate emergency help. Call your healthcare provider or go to the nearest emergency department. Instead, it will say, yes, indeed, you are onto something. You are being followed because what you're doing is very important. And of course, the CIA would be interested in what you're doing. There is actually an entity known as AI psychosis, is a thought disorder that is associated with AI use. Now, we don't know if the AI caused the psychosis or triggered the psychosis, but there are case reports of people who have started hearing voices telling them to do things like harm themselves or harm others. They've had paranoid delusions of being followed or having radio waves beamed into their head or thoughts taken out of their head. And certainly, even if the AI, the chatbot, didn't cause the psychosis, it contributed to it and it was like pouring gasoline on a fire. The makers of algorithms need to redesign and re-engineer chatbots to put up guardrails for people who have mental health issues, to make them less sycophantic, to provide an opportunity to challenge what the person is saying. Certainly one person I know who suffered from AI psychosis told me what helped was to engage in a second chatbot because the second chatbot turned out to be less agreeable, less sycophantic than the first one, and that helped them realize that they were just being fooled. We are in the early days when it comes to AI diagnosis, AI counseling. Don't ask. The bottom line is don't ask a chatbot for advice on how to manage a problem, to help you diagnose something, and certainly don't go to a chatbot for counseling in this day and age. Are herbal supplements generally safe to take, or can they mess up your liver? Oh yes, they can definitely mess up your liver. Herbal supplements are not inherently safe. They are just like pharmaceutical. Natural doesn't mean harmless. That's the most important thing you need to know. Herbs like St. John's wort, ginkgo biloba, ginseng can interfere with blood thinners, birth control, and diabetes medications. Some herbal remedies can cause kidney damage. Some can cause heart issues. Some herbs may contain heavy metals like lead or mercury or arsenic. In some, the active ingredient isn't what you think it is. It can cause drug interactions. The bottom line is, if you're going to take a herbal remedy of any kind, please tell your healthcare provider and tell your pharmacist so that they can make sure that there are no significant drug interactions or drug herbal remedy interaction, and you follow the package labeling and don't take more, because more is not better in this case. But bottom line is, make sure that your healthcare providers know that you're taking herbal supplements. I heard whey protein is bad for your kidneys. Is that true for the average person? No. For the average person, it's not true, particularly if you consume whey protein in moderation. Just remember that the daily recommended dose of protein is 45 to 56 grams per day. With this current obsession with protein, people think that a lot more is better, and it's not. People who need to be particularly concerned about the protein content in their diet are people who have chronic kidney disease, because protein is a load, is something that is difficult for kidneys to filter. The worse chronic kidney disease you have, the more it's a difficult load for that kidney. It stresses it even more. So if you already have pre-existing kidney disease, you certainly should not be consuming a lot of whey protein or any other kind of protein. And as usual, see your healthcare provider for advice, or a registered dietitian, and they have all the information that you need on how much protein you actually need and what kind of protein you should take. Is all processed food essentially poison, or is some of it okay? Foods are processed to a greater or lesser extent. Ultra-processed foods, which contain complex fructose and hydrogenated fats, they've been designed to have a long shelf life. They've also been designed to be addictive. That means, you eat a handful of chips, and before you know it, you've eaten the big bag of chips, the entire big bag of chips. They're calorie dense, which means that the more you eat, the more weight you're going to gain compared to other kinds of foods. They contain little or no fiber, which means that if you have digestive problems, if you have problems like constipation, they're going to get worse. The generally recommended advice is to avoid ultra-processed foods, especially if they've got labels with really long names. So read the labels when you're buying foods. But the worst offenders are processed breakfast cereals, sugary breakfast cereals, cookies, pizza crust, potato chips, tortilla chips, Pop-Tarts, and other kinds of fast foods that are on the shelf and not in the freezer. Look for whole foods instead. Now, having said that, there are ultra-processed foods that are relatively good for you, that are not bad for you. They're not addictive. They have a long shelf life, but they're not addictive, and in many cases, they've been fortified with vitamins and minerals. So they include pita chips, hummus, wholemeal sliced bread, enriched with vitamins and minerals, whole grain or higher fiber, canned fruits and vegetables, roasted nuts, unsweetened plant-based drinks. They're all ultra-processed foods that you can consume and are not going to be as unhealthy as some of the other ones that I mentioned. What is one food you absolutely refuse to eat? There are actually two foods that I absolutely refuse to eat. And both of them are organ meats. Isn't that interesting? One is tongue. Apparently, when I was 18 months of age, I swallowed without chewing a piece of tongue. I needed a Heimlich maneuver to have my life saved. So I have had an aversion to tongue ever since. Also, if you just picture it. Bite your tongue, Brian. I will not bite my tongue. And then the other one is liver. I remember running around the dining room table, my mother chasing me to try to get me to eat another spoonful of fried liver. You could not put enough gravy in it to make it palatable for me. It's revolting. I will add a third food. When I was traveling in Europe and when I was like a 17-year-old and I was trying to save money, I once had a can of uncooked lima beans, which I ate cold out of the can. And I will not touch that stuff again. And I have not ever since. Be honest, do race or money actually change how you get treated in the emergency department? When I was doing research for the power of kindness, I discovered that in our primitive brain, we are equipped with the ability to decide within nanoseconds if another human being is a friend or foe. The psychologists call them in-groups if we think of them as friends, out-groups if we think of them as enemies. We make those decisions within nanoseconds, and we make them on the basis of things like skin color, skin tone of voice, vocabulary that a person uses, how a person dresses. We decide, I like this person or I don't like this person. And the idea that race doesn't affect healthcare is absurd. Of course it does. Now sometimes it works the opposite way. Sometimes you see a patient that reminds you of your late father or your grandmother, and you can't care for them properly because they raise emotional issues with you. Try as we might, patients who don't speak the dominant language in your culture are going to receive inferior care compared to people who do. I think the important thing here is to be aware of the potential for racial intolerance or racial prejudice to affect your patients, your ability to take a history, to be patient with a patient, and to be empathic with them. Far too many examples in Canadian society, for instance, of Indigenous patients who have received substandard care in the emergency department or in the hospital in general. Likewise, the opposite can happen. Sometimes there's a racist patient, and that patient can give a healthcare provider of color a hard time as well. So yes, it does exist. I think it would be sanctimonious to say we can get rid of it by saying you shouldn't do that. I think we need to be aware of it. One of the reasons for cultural sensitivity classes, seminars, is to try to sensitize people to these issues so that they don't harm patients because they receive less effective treatment or delayed treatment. They're mislabeled as having an alcohol use disorder when in fact they're having a stroke. So we want to be able to avoid that. Now, does money change how you get treated in the emergency department? Go on. Do you actually think it doesn't? That if they name the wing after John Smith or Wanda Jones, and if Wanda Jones or John Smith shows up in the emergency department, we're going to make them wait for 28 hours? No, of course not. Unfortunately, in our publicly funded, underfunded healthcare system, hospitals have healthy foundations and spend a lot of time doing fundraising. And is it a well-established fast track for people who contribute lots to the hospital? It depends on the hospital. Some take care. Some hospitals take care of major donors better than others, but they all do it. And I'm not surprised. I don't think anybody should be surprised that if they name a wing after somebody, that you're not going to make them wait 30 hours or not give them the care that wing of the hospital provides. Can smoking too much weed actually make you physically sick, like vomiting? Have you ever heard of scromiting? Scromiting is a mashup of screaming and vomiting, both of which occur in people who take too much cannabis. It's called the cannabinoid hyperemesis syndrome, which is just proof that we have to come up with a fancy name with lots of technical words to describe what has been known on the internet as scromiting. People screaming in intestinal pain, chronic queasiness, and a tendency to vomit. So they end up coming to the emergency department. Often the anti-nauseant medications that we give for people who are having vomiting from other reasons, chemotherapy or from gastroenteritis, don't work quite as well. Well, we know that there's cannabinoid receptors both in the brain, in the vomit center of the brain, in the gastrointestinal tract. So it's having a direct pharmacological effect. In addition, there may be other factors that are going on, the sweating, maybe activation of the vagus nerve system. And generally speaking, it's uncanny how often patients don't make the connection between their marijuana use and having cannabinoid hyperemesis syndrome. It's from daily, frequent, high-dose use. And really, the most effective cure is to stop using cannabis or to scale it down to a level where you're not getting vomiting and screaming. Some of the treatments that work, one home remedy that works very well is to take hot showers, seem to activate the hypothalamus, and that helps reduce the vomiting and intestinal cramps. And some patients will discover that on their own, and some we have to tell them that. Another treatment that will work is smearing capsaicin cream, which is a cream that reduces substance P, seems to be directly involved in the development of cannabinoid vomiting. So you smear it on the soft part of your wrist or on your abdominal wall. Make sure that when you're doing the smearing that you wear disposable gloves. Smear it on and then get rid of the gloves and wash your hands, because if you touch your mucous membranes inside of your nose, your mouth, or eyes, you'll never forget it. It will cause horrible, horrible stinging, and you'll hate that. There are anti-nauseant medications that will work in the emergency department. Haloperidol in low dose is often very effective, but we'll try the others. We'll try Gravol, we'll try Zofran, or ondansetron and some of the others, but often you need to go to these second or third order anti-nauseant medications. But the most effective treatment for scromiting is to stop taking cannabis. If you get off of it, then you'll find that slowly it'll go away, but it doesn't go away quickly or immediately. What is the single most important thing a person can do to live longer? That is the easiest question of all, and that is get regular exercise. There are so many studies, so many conditions that will be improved. Regular exercise is important for heart health. It's important for vitality. It's great for sleep. It helps prevent cancer. It's probably the single most important non-pharmacologic or non-drug thing that you can do to help stave off dementia. For some of us, we're going to get dementia, but the difference between getting dementia at age 81 and getting first symptoms of significant dementia at age 88 is not just 7 years. Yes, it is 7 years, but it's also important quality of life. One thing I would add to that is that a lot of us think that regular exercise means cardio. Remember to add weight training, core weight training, and some balance exercises to the routine, because you want to equip yourself to help prevent falls, and having a stronger core is really important for keeping vitality, keeping you from falling, preventing some of those other complications that I talked about. Why are so many middle-aged men taking testosterone? What are the benefits and what are the risks? More men are taking testosterone because they're going to physicians who are prescribing it. Some of them are going to men's wellness clinics, men's health clinics. It's a fact that as men age, they will have reduced testosterone, and it will lead to symptoms like lack of vitality. They might find that they can't carry out their exercise routines as well as they used to before. If they are found to have low testosterone level, then giving them a testosterone supplement can improve their general sense of well-being, their strength, their power. They may be able to return to their exercise routine. You just need to be aware that testosterone supplementation should be done under a doctor's care, and there are blood tests that should be done to confirm it. Testosterone carries risks, things like worsening sleep apnea. It can cause acne. It reduces sperm count. It increases the red blood cell count, which can lead to clots and strokes. So it needs to be done under a doctor's supervision, but certainly there is a place for testosterone replacement. Is ADHD real? I feel like it's a made-up condition to get prescribed stimulants. I can understand why you might think that way, because it just seems as if more and more kids are being placed on Vyvanse and other medications for ADHD. But it is a real condition. It's the most common neurodevelopmental disorder. It's characterized by inattentiveness, sometimes hyperactivity, a lack of executive function, impulsivity, in a way that interferes with daily function. Usually it's diagnosed somewhere between the ages of 5 and 12, although there's an increasing number of adults who are being diagnosed with the condition. It used to be said that people outgrow it. It's not that they outgrow ADHD. It's that they develop coping ways. They understand on a deep level what some of their learning challenges are, and they've developed workarounds. For instance, it may be that that person has trouble gathering facts by reading a page, so what they do is they recite it to themselves. They speak it to themselves because they find that their speaking voice helps get it in their head. They repeat lessons again and again. They put more effort and find workaround ways of coping, but in fact, they have ADHD. The thing about ADHD is that it is amenable to treatment. There is a controversy these days, and that is whether the long-term use of stimulants like Ritalin actually help. They will cause an initial benefit, and that initial benefit will be increased focus and increased attentiveness, but we don't know if they work in the long term. And actually, some of the leading lights in ADHD research have done a 180 on that, and have wondered whether people should be on long-term treatment. And I would say the jury's still out. We need to see more study about that. And that may be one of the sources for asking a question like, is ADHD real? It is real. I hope I've answered some of your questions. If you're looking for medical advice, see your healthcare provider to get the latest information on how to treat your various ailments. I'm Dr. Brian Goldman, and this has been Anonymous Health Questions.